I think this is a great course because traditionally when we talk about occlusion, we always feel it's a mystery about it. Even when we learn a lot in the prosthodontic program or in a lot of continuing education course, a lot of parameters we only can assume we can find these parameters. But this is the first course ever I learned how to use it in a digital way with the technology assist, especially with the CCAT functional. So we can get these parameters applied into our CEREC machine. Then this actually answer our questions when we do our occlusion design with the CEREC, and how do we propose a restoration. And this is quite an essential part, especially for full-mouth rehabilitation case. And this course also helps us to do by sequence, summarize all the researches and all the theories, and give us something very practical to use in the daily practice. And traditionally, when we do a full-mouth case, we have to, the whole case maybe ongoing at least like 6 months or 1 year. But with the assisting of the technology, actually the case can finish way shorter. And the patient also can, the patient response will be much greater. That's one thing. A second thing is we actually, literally first time we can really find some real numbers and the real parameters apply, including, for example, the condyle angle, the bunion angle, and all this number before we only can assume, or we can only count on the analog articulator, but which was which we don't really know exact number, and then we do in this analog way, a lot of errors can occur. That's why it takes a long time for the patient to actually adjust to the new temporary. But with in this course, actually what we learn, we can reduce this adjustment time, and the patient also can get used to this occlusion much quicker, and also shorten the treatment time. I think we are entering a new era of dentistry. So dentistry used to be patient need to undergo a lot of long time, and they would keep on testifying to see which, okay, is this occlusion going to work for this patient? But with this course, we actually all what we learn can apply to it. So actually shorten, really literally shorten the treatment time. I think that's quite essential, the benefit to the patients. And for the clinician part, we finally can apply some very theoretical occlusion theory into a very practical case, and in a very scientific way and very practical.